So our topic 3 is focused on exposure. Our first speaker is Dr. Tracy Kirkham, who's an assistant professor at the Dalla School of Public Health at the University of Toronto and senior scientist and associate director of the Occupational Cancer Research Center at Ontario Health. She is a Master's of Science in Occupational and Environmental Hygiene and a PhD from the School of Population and Public Health at the University of British Columbia, where she investigated cardiovascular risk factors among career firefighters. Since her PhD, she has been involved in 5 firefighting exposure and epidemiology studies. She was also a working group member for the exposure assessment piece of the IARC monograph, volume 132, and organizer of the recent Firefighter Cancer Research Priorities Workshop held in Ottawa, Canada. So please welcome to the stage, Dr. Tracy Kirkham.
As everyone mentioned, or as it was introduced, my PhD was in firefighting, so I've been in firefighting for a few years. And I had the very unique opportunity in my PhD to follow my research subjects for a full week, which meant I got to go on ride-alongs with them for a full week. And I got to go into all the calls. So it really opened my eyes and gave me a good perspective and an understanding of kind of what the job is like for firefighters. So today, how do I put this thing up on the screen? Okay. So today I'm going to talk to you about diesel exposure in fire halls. A lot of the, I think, focus has been often on exposures during fires. And we know that there are a lot of other exposures, such other carcinogens, that are potential exposures when not at fires. One of those is diesel engine exhaust. We know that diesel engine exhaust is a known human carcinogen, and that firefighters can be exposed at many different times. This includes while working or riding on or operating the fire engine, when working around an operating fire engine, such as when they're standing at a call. You know, the pump operator will be standing there operating the pump while it's running, and people will come and talk to them while they're standing there. They also do equipment checks, which has the vehicle apparatus running, and then also working near areas or in areas where there's lingering exhaust. One of these locations that have been identified as a potential is within fire halls. And some of the earlier research done, mostly just by NIOSH in their health hazard evaluations, has pointed this out. We do know that there's a number of controls available to reduce exposures to diesel engine emissions, but we also know that awareness of these controls can increase adherence, which then therefore decreases controls. We know that this has been associated with education level about the control and the hazard, and also the safety culture. But we don't really know much about what's going on in this area for firefighters. So for this study, we wanted to look at what are the diesel engine exhaust controls that fire departments are using in Ontario. What is the awareness level of the firefighters in the fire departments about these hazards, and how do they feel about them, if they feel like they are effective or not? And then for a few sub questions, we wanted to know of how well they may adhere to these controls. So this study was part of a larger study where we went out and we measured diesel engine exhaust in fire halls. And for this study, we had 12 fire halls across 6 different cities. These cities ranged from very large to very small. And the halls that we selected was the first one was the busiest hall, to kind of mimic what we thought might be worst case. And then the other hall to be a hall that had a different hall design, or was another hall that was slightly busy. For each of these sites, we went 2 times, once in the summer, once in the winter. And just to mention that we did interviews during these times, both at the pickup and at the drop-off. So that was 2 different shifts for each hall at each visit. We also requested for the fire departments to give us a list and a description of all of the policies and procedures, or all of the controls that they use for diesel engine exhaust. This is a way for us to look at what controls are being used in Ontario, and then also to look at adherence and awareness. We also did walkthroughs during this time where we looked for observations such as soot on walls, the diesel engine exhaust smells, whether or not the apparatuses were being connected to the LEV or the local exhaust ventilation, if it was present, whether or not the doors to the living quarters were closed or open. So for the interviews, we did closed room, in-person interviews that lasted around 10 to 15 minutes, so they were short. I should mention this is part of a master's project. And these interviews included things such as information about themselves and their job, knowledge of their control measures, their perception of how well these control measures worked, and the health concerns that they had regarding diesel engine exhaust. So for the results, this just showing you a table of all of the different diesel engine exhaust controls that were reported to us from the different departments. And on the top, we can see, oops, where is this? This right here. We can see here that these are the number of fire departments. And then on the other axis is looking at what the different controls are. And we separated this out into engineering controls, administrative controls that are policies, and other administrative controls. So we can see for engineering controls, we have general exhaust ventilation, which was used by all halls or departments, and then also local exhaust ventilation. So these might otherwise be called extraction arms or Niederman arms. Diesel engine fluid or diesel exhaust fluid, ceramic filters that are attached to the apparatus. And then for administrative controls, we have policies about how the LEV should be used, policies about safe driving, idling restrictions within the vehicle bay. Then there were a couple policies about idling and restrictions with having the vehicle bay door open. So if you were operating the engine inside of the bay, the door must be open. If you're idling the vehicle outside of the bay doors must be closed. And then having all the doors and hatches between the vehicle bay and the living quarters closed. The truck equipment checks to be performed only outdoors. And then for the administrative controls, we have the gas monitors installed and the diesel engine exhaust training. I just wanted to point out that only 3 departments had official training for diesel engine exhaust controls. And this is showing a wide range of how some departments, such as Department 1 and 6, used a lot more controls than some of the other departments, such as Department 4, which only had 2 different types of controls. So for our survey, we ended up with 81 participants, 60 of which were firefighters, and 21 were supervisors, so being lieutenants and captains. On average, they had 15 years of experience, but this ranged from 4 months to 35 years. And I didn't put it up here, but they were all male. And there just was not a single female on any of the shifts that we ended up visiting. So for the population concerns, we were just interested to know how often they felt like they were exposed to diesel engine exhaust. So we can see around 38% of firefighters. And just as an example, explanation, in all of these, the orange represent firefighter and the green represents supervisors. So around a third smell diesel exhaust regularly. Now 15% of firefighters and 30% of supervisors say that they feel irritation from diesel exhaust. And there was quite a high proportion that were actually concerned about their diesel exhaust exposure. So we asked them, do you feel like diesel engine exhaust policies and procedures for controls are useful? And then we see here that quite a few people, so 88% of firefighters felt like the diesel engine controls are effective, and 95% of supervisors felt that they were effective. So it's quite high. So for the people who said, no, we do not believe that they are effective, we asked, why do you not think that this is effective? And the main thing that came out is that they said it was a faulty control. Some of the other terms used where it's not consistently used, it's relying too much on worker behaviors, and there's human error. Some people said it was unsafe, and another one was not maintained. Now, in this original larger part of the study, we also monitored or evaluated the ventilation for all of the extractor arms, and we found that on average, those extractor arms were only working at a 56% efficiency based on the manufacturer's recommendation. So that this may have validity in their concern. For those people who thought that the controls were effective, we asked, why do you think they're effective? The number one reason was that they felt that it reduced exposure. Some of the other things they said was it increased awareness, increased worker education, improves work safe practices, and there's good rules and set standards. So a number of people mentioned, they said that firefighters are paramilitant and they like these strict rules and regulations. I laughed too. Yeah. So overall awareness was 57%. But what I really want to point out here is, so this is measuring the proportion of people who correctly identified that they had a control when it was present. So if we look at the engineering controls, we can see that 100% of the people who had LEV in their hall knew that they had LEV, which is great. But when we look at the awareness of other diesel engine exhaust, it's much lower. So 9% for general exhaust ventilation, 5% for diesel engine fluid, and nothing for ceramic filters. This might not be as important for engineering controls because none of those controls rely on the actual individual firefighter to work. However, when we look at administrative controls, we can again see that everybody who had a policy about LEV use was aware of that. But the awareness for the other controls go down quite drastically. Even something as simple as an idling restriction, which we thought that most people would be aware of, is only 28%. And some of these are 0%. And interestingly, no one mentioned that training was a control. And as a hygienist, training is one of the big controls, administrative controls, that we promote. And I just wanted to also point out quickly that the LEV use, there's a little asterisk next to it. This is because there were some people in the hall who didn't have LEV, but reported having LEV, which was a little perplexing to us. And I just want to start this with a disclaimer that I need to go back to the raw data to double check this. I've already double checked it, so I triple check this data because it doesn't make sense to me. So we asked the question of, does idling occur in your vehicle bay? And we wanted to ask this generally so we could see, does this rate differ between those who have a policy versus those that do not have a policy to restrict idling? And we see here that people who don't have a policy report 60% say, yes, we have idling. But those with a policy where we should expect a lower amount actually has increased to 74%. Similarly, we also asked people who had LEV units, is the LEV unit attached every time it enters the vehicle bay as required? And similar responses where we see around 40% with no policy saying yes, and 58%, so an increase when they actually have a policy. Now, why this is, I'm not sure. One thought might be that they're more aware of it, so they're paying closer attention. But as I mentioned, that's a disclaimer, we need to look into that. Also, lastly, research observations. So we did observe that 17% of the time the LEV units weren't attached properly, and also that there was around 14% of the time the doors and hatches to the living quarters were left open when there was a policy in the department. So overall, I think the key message is that there's quite a low awareness level for diesel engine exhaust controls in the Ontario fire departments, and it triggered us to recommend that they need to think about implementing a training program for their workers so they're aware of what the diesel engine exhaust controls are. And then also that we need some additional research to investigate not only diesel engine exhaust but other controls. How well they work really depends on if people adhere to them. and whether or not awareness increases this adherence or not is needed. And lastly, just a thank you slide. My acknowledgements, obviously, to all the firefighters who put up with our staff asking them questions. Whoops. And to the fire departments for allowing us to come into their space to conduct the research, as well as all of our field staff.